So my name's Kylie. I'm one of the liver specialist nurses at Birmingham Children's Hospital, and I worked with Maranthe for quite a long time. So thank you very much for asking me to come and do this talk today. So there are a few of us at the Children's Hospital. We have about 8 people within our team. So not only covering the ward, but patients who have gone home and at an outpatient setting. So this is a really old picture. There's a lot more of us here now, but there's just a few of our nurses and our admin team there. So as a specialist nursing team, we strive to deliver an excellent standard of care to all our patients and our families, and to assess and provide a holistic approach to meet everybody's individual needs, as every patient is different. We also work within the ward and the wide multidisciplinary teams, so alongside our dietitians, our consultants, surgeons, physiotherapists, and we do this, as I say, as an inpatient and an outpatient setting. These are just a few things that we do cover. So we have information sharing with all our families. We do some disease assessments, so not only just for our transplant patients, we look at our patients with liver disease and give them all of the information that they need regarding new diagnosis, life in the future. And we also assess at what part of their disease they are and try and give them ongoing support. We do training for nurses on the ward and throughout the hospital as well. We do clinic reviews. So at the moment, we have actually got nurse-led clinics that we have started probably about 18 months ago now. So we're looking to expand that a little bit more. We manage all of our patients' anti-rejection medication. So we monitor their blood tests when they're home and advise on any doses that they need to be taking. We also arrange all of the delivery of the medication and manage all that as well. They come back to the hospital after 1 year, and then 5 years and 10 years post-transplant. So we call them annual assessments. So the specialist nurses carry those out, looking at their quality of life and if there's anything else we can support them with if they've got any questions. We get involved with all the research that's involved within the liver unit at the hospital. And we have a nurse-led service, which we call Liver Direct. This is a telephone and email contact that we can communicate with all our patients, our families, and consultants and shared care across the country, and sometimes internationally as well, if people need advice from general hospitals, GP surgeries, things like that. So that's just a few things that we do cover. We do all of the transplant assessment for our children and our families. So this is just a little bit of an example of a program that they get given at the beginning of their admission. So they come in on a Sunday to our ward, and then we introduce ourselves on the Monday morning. We then go through the program and what is involved within the transplant assessment. So they'll meet dietitians, the surgeons, play specialists. We have family support workers that will help them throughout their process, pre and post-transplant as well. They'll meet the transplant coordinator to go through what the process is for them, and then all of the investigations that they need to be assessed whether they need a liver transplant or not. So this is just an example of the programme. So the members of the team that we have throughout the assessment week is ourselves, the specialist nurses. So we give all of the information and the counselling. The dietitians, who looks at their nutritional assessment and gets them into the best place possible for the time of transplant. And then we'll support them post-transplant as well for recovery. Play specialists and the adolescent team will prepare the child and the young person, and also the siblings, if there are any within the family, because obviously we can address that this is a difficult time for everybody. Psychologists will give emotional support and coping strategies. alongside our family support workers who can help with general life support, such as finances, employment, their housing. So we're really lucky to have everybody involved within our team. They'll see the transplant coordinator to explain donor and availability. They'll see the surgeon to talk about their transplant techniques and any complications that might occur. The anaesthetic will go through the risks, pain relief, and where they're cared for immediately after transplant, which our patients go back to intensive care for a period of time. They'll then see the hepatologist, sometimes the gastroenterologist, stoma nurse if it's a small bowel transplant, and then we look at dental and respiratory consultants if they have other conditions. So this is just a bit about the investigations that we look into. So they'll have an ultrasound, blood test, sometimes they'll have an upper GI endoscopy, biopsies. We'll look at their line access. So we'll make sure that they've had some neck ultrasounds to see if their access is all okay. We'll do an ECG and an echo and a neurodevelopment. And this is all pre-transplant. Once the child has then had a transplant, we support them post-transplant on the ward when they're inpatients, along with their family, as I've already previously discussed a little bit. But then we start to think about discharge. So we do all of the discharge planning and the training with the families and local consultants. We have something called a shared care protocol, which will give instructions and directions to other centres if the child is to become unwell or have deranged blood tests. We'll start to have these conversations and start to plan using teleconferences. We'll arrange where they will have local blood tests closer to their home. We'll review if they need any vaccinations going forward, and if they do, we provide a vaccination program for them. We'll contact other specialities, health visitors, community nurses, and if they have any local specialist nurses closer to home that they already have a bond with. We'll then start to train our families on all the medications that the child has started and how to use them, where to order them from, and how long they need. So monthly supplies is what we recommend our family have, and to just keep on top of them. But we'll support them with our liver unit outpatient line, which is Liver Direct. If they're on nasogastric feeding, then we'll help arrange all their equipment and organise community nurse support with that. But we'll also do the training on the ward on how to use a nasogastric tube with the parents and their families. We train them on fluid balance. So I'll show you a fluid balance chart that we use to train our families on a little bit later. But we do all of the training on fluid balance and explain how to return to their normal lifestyle and how going forward post-transplant, what becomes their normal lifestyle and what they can and can't do to have a good quality of life. As mentioned before, we have started nurse-led clinics now, so we follow all of these things up post-transplant in the clinic every 2 weeks. This is just an example of the medication training drug chart that we use. So it will have the medications listed on the left-hand side. Each patient will be on different doses of medication. And then we will write the times in. And this is just a little something that we use to help our families keep monitor whilst they have the support of the ward nurses and the specialist nurses whilst in hospital. This is a fluid balance chart. So as you can see, we measure our patients' fluid balance every 24 hours. And it's something that we want them to carry on for a short period of time if they have had a liver transplant on discharge for approximately about a month. And then if they have had a small bowel transplant, we like them to do this daily, every 24 hours, send us copies of them to our Liver Direct email address, and we want them to do that for 6 months. So again, it's a lot of pressure on our families to have to do all of this, especially after having a transplant. It's a different lifestyle that they have to live. So that's why we're there to try and support them as much as possible. So this is what our shared care protocol at the front looks like. It's quite thick, so I won't go through the whole thing, but the information within this is any infections that might be occurring with the child if they present to their GP or their local hospital, what monitoring they need to do and what investigations, who to contact here, like at Birmingham Women's and Children's Hospital, any clinic appointments that they may have in the near future, and complications and communications and medications. So they will always have someone or somewhere to contact for any advice if anybody has any questions. But we also give the family a copy of this so that if they travel anywhere across the world, then they have this with them, and it gives shared care hospitals again the opportunity to contact us and ask us any questions. This is a vaccination program. So we would like our child to have as many vaccinations as possible pre-transplant, but we know that this is not always possible if our children are unwell to receive the vaccinations. So post-transplant, all of our children are not to have any live vaccines. So this is what really came from this, that it gives everybody something to follow and clear guidance of what the child can and cannot have. So every patient post-transplant is given one of these vaccination programs. It helps us assess their needs to see if they've had their pre-vaccinations, their primary vaccinations, and if they have, then they're ticked, as you can see. And then what other vaccinations we require post-transplant. We review these for each patient yearly at their annual review when they attend the ward. So the immunosuppression is actually managed within our team again, but we have a nurse now which monitors our immunosuppression closer than most of the specialist nurses, even though we do have a lot of involvement with her. Her name is Bernadette Robinson. She's been with the unit probably for about 2.5 years now, and she coordinates all of the management of the immunosuppression, which includes liaising with the pharmacy, and we manage all of the delivery of medication to the patient's home. We now have over 600 patients on home delivery that the specialist nurses have to monitor their prescriptions for all of their delivery and their blood results. So we have patients on weekly blood tests, 2 weekly blood tests, but our stable patients will always have 3 monthly at least. So we monitor all of the bloods, manage them, and then we arrange their prescriptions for their delivery after they've had their bloods done. So that's a little bit about our immunosuppression management. So the Liver Direct service, I said before, it's a telephone service and an email service, and these are the people that can contact us. It's covered Monday to Friday, and then all the other calls have to go to that outlying registrar who will be covering out of hours on the weekend. But anybody can use this, you know, different hospitals, GPs, parents, carers, schools. We get approximately 4,000 calls a year, if not more. And this actually helps our doctors within the trust as well, because 90% of our calls are actually dealt with nursing advice alone, and 90% are dealt with the same day. We're just doing an audit on the Liver Direct service at the moment to see if we can improve the service and actually deal with more than 90% to relieve the pressures from the doctors and the consultants. This is an immunosuppression monitoring blood sheet. So the patient's name will be at the top, what medication they're on, what dose they're on, how often they're having their bloods. And then I know it's a little bit small, sorry, but the bloods will be listed as a result. So the date will be written at the top. There is the investigations listed on the left, and then the result next to that in the column. We then review these blood tests, and if we have any questions, we will show the named consultant who will advise on when to repeat the blood tests and what dose of medication. We then go on to contact the families and tell them and communicate what medication they should be having and any changes that are made. We also then have to complete a new prescription and liaise and communicate with the pharmacy delivery team too. So this was a little bit of feedback from some of our patients, just to say that they do find us helpful and they are grateful that they feel that there's somebody they can contact at all times. They feel that their communication is answered very quickly, and it gives them the confidence to be at home with a new way of life, knowing that they can ask whatever question and they're never made to feel that questions are trivial. So that's just a little bit of a feedback from our parents and our families. So our annual review is a 2 days admission. This is when the children come back after transplant every year. They have some medical surveillance, their blood's done, and they get another copy of a timetable, so who they need to meet. And we do a quality of life assessment. And actually, some of our data was presented internationally in a small bowel conference in New York, and we had some really good feedback from that. So I think families knowing that they can be monitored yearly gives them the reassurance as well. And to just make sure they're making their developmental assessment milestones. We do have close connections with 2 charities especially, which is our Split charity. This is supporting patients with a liver and intestinal transplantation, and our Children's Liver Disease Foundation. Now, you can use their facilities. They both have websites, which I can send over to Maranthi at the end, and she can forward them on to you all. They give advice, and we work alongside them both, giving up-to-date relevant information regarding diseases and what processes everybody follows. We do education throughout the trust, so not only with our patients and our families, we do them with all healthcare professionals internally. We've done them locally and internationally, presenting at national and international conferences. Our in-house training sessions at the moment are more with the PN study day. We do ward teaching, and we do study days across the trust. One thing we have started is a hepatology course within the university local to the hospital, which nurses can attend for a 6-month period, and the specialist nurses are involved in the teaching on that course. So research and audit. So we initiate nurse-led research and audits throughout the unit. We've recently audited our hepatitis A and B uptake in the transplant patients, the use of modograph in the intestinal transplant population, which is our standard within our children's hospital immunosuppression that we use. This is the brand of tacrolimus modograph. Our liver direct activity, our vaccination programs, and our shared care protocols. And it actually identifies patients for potential research projects alongside their care as well. So it's giving them the best care possible going forward. So future developments that we would hope to have within the unit is that we can progress to a text messaging service. So we know that a lot of people now are reliant on their mobile phones and actually answer to a text message more so than a phone call. So we're trying to actually develop that at the moment. It probably started about 3 months ago, but at the moment it's not getting very far. So I'll have to update you all on that. The call waiting system. So if we're on the telephone to somebody and another patient calls or their family calls, it doesn't give them the option to wait. It will just ask them to leave a message. So actually that increases our workload, having to pick these messages up alongside having the phone live at the time. So we can hopefully have a call waiting system so that they can wait in a queue, but also have the option to leave a message if they're in a rush and can't wait in the queue. We develop all of our leaflets for our families and our patients within the hospital, and we've actually translated some into some common ethnic languages as well. And we are just developing the leaflets for our liver and kidney transplants. We work alongside the Children's Liver Disease Foundation, which was the charity that I've just spoken about, to work with them for their leaflet production as well. So actually it gives up-to-date, relevant information. This is just there's a few consultants that Maranthi will recognise on there, but some of our children who we try and celebrate the success every year. So at the moment we take part in the Transplant Games, which has just happened actually in the summer, and our children actually won 25 gold medals, and they were all transplant patients. We have our children go to Disneyland every year, so we can choose up to 5 children who will go to Disneyland in Paris and celebrate the success of having a normal life and living life to the full. So there's just a few pictures there of our patients who are our success, let's say. So I think that's everything. Sorry, I feel like I've flown through that. Has anybody got any questions?
So as I mentioned, our center, our team is still in the developing stage. So our nurses, they do double work, triple work. I mean, we do not have dedicated specialist nurses like such, but I would say they are doing the work. So what would be your advice for nurses who are just in the program which is in the developing stage? What would be your advice for them in general?
I understand how hard it is, because obviously back when we first started, there was no such thing as specialist nurses either. It was what you guys are doing now, everything, caring for the patient, as well as doing everything that I've just explained, which our role is. So my advice is to be there for the patient, be empathetic, understanding, and that will make you a specialist nurse without doing all of these extra jobs. It's no different to your nursing, caring for that patient, but also try and use the facilities across the world that are there. We're such a specialist thing to do in paediatric liver transplants. It's such a privilege to have the research and the facts out there. Use them, try and connect with these conferences. That most of them are online, most of them are free, just to get the education and the learning, to be able to give you the confidence. And that's the biggest thing, the confidence and the empathy, and being there for your patients and their families going forward will give you the confidence in caring for them. And the knowledge and experience will come with time and takes a long time, takes a while, but it's an absolute honour to work with paediatric liver patients. And I think I'm biased. I've been there too long. I think I've been there now 16 years. So yeah, it's an amazing thing to be involved with, but I do understand how difficult it is when you're nursing as well as having to do all of these speciality follow-ups with patients. So use the facilities out there, and knowledge, guidance, compassion, empathy.
Thank you